It's hard to believe, but another week of our virtual existence has passed us by. Being removed from the normal rhythm of the work week makes it difficult at times to track the days. Every week that passes reinforces for me how long it has been since we were together as an academic community. Despite the virtual reality in which we now live, or perhaps because of it, however distant we may be, each day brings with it meaningful moments of inspiration that unite us and define our vibrant community. Early last week, as I walked into my office, I was greeted by an environmental services worker. I thanked him for his efforts during these challenging times and asked how his family was doing. He answered, "Doc, they're fine. We're getting along. I want you to know they are very proud of me that I am on the front lines." I told him I wished I could give him a hug of thanks, but he let me know with the look in his eyes that he appreciated the thought. I'm so proud to have him as a colleague. I continue to receive regular updates from caregivers who are on the front lines across our clinical affiliates. There are common themes to their communications, including rising fear about exposure and increasing concern for the health and safety of their families. One of our students in the Graduate School of Nursing informed me about all the extra hours she and her colleagues are taking on to meet the needs of their patients. She noted the complex balancing act of being both a parent and a nurse. On the one hand, she must be there for her children, which now involves assuming responsibility for homeschooling. And on the other hand, she must continue to care for others, sometimes without adequate PPE. I heard from a graduate student who's so motivated to be in a lab where COVID-19 work is underway and who's working from home to support the PI. I received message from so many medical students about our decision to graduate them early so that they can be in a position to work in our clinical affiliates should there be a surge in new patients. Right after the decision, one texted me, "Count me in. These are extraordinary times." I'm so proud of our community of learners who place the needs of others above their own. So too, many members of the faculty have been in touch. Several wrote to let me know that they would work without pay if that became necessary. Others spoke with pride about the support of their colleagues as they collaborate to find ways in which to understand more about COVID-19 as we search for a vaccine or a treatment to mitigate the virus's unrelenting spread. It's so encouraging to serve with such an incredible faculty. In each instance, and in so many others, I have been inspired by the selfless acts of courage, determination, and thoughtfulness. So many are committed to the needs of others. Acts of kindness abound, be they a call to the lonely, a wave at the window, a note from a donor or a friend from past days. Amidst it all, these are days where inspiration is infused with actions by those who care for others. As we face this next week, there shall be many more moments that inspire. We look forward to our School of Medicine graduation, where our fourth-year medical students shall be among the first in the nation to receive their degrees and have the opportunity to work where needed most. We shall have to celebrate virtually something so unnatural for our community. But together, from that momentary and necessary distance, we can embrace our new graduates with pride in knowing that forever we shall be able to call them one of our own. I recognize that the number of people who are getting sick continues to mount, and the peak of cases remains in our future. The day will come when this will be behind us. Whatever the new normal becomes, we shall hold on to it with memories of this solitary time. And when that time arrives, our memory will be full of the inspiration we received when times were more challenging. And for that, we shall be better as individuals and as a community. I so look forward to the brighter days ahead. While that horizon may be somewhat in the distance, be assured that each of us is integral to the success of our medical school. And for that, I am most grateful.